Hi guys, good morning. Thank you for joining us. My name is Dr. Garayi Shava and I'm with Afrimom Pregnancy. And today we want to talk about COVID-19 and pregnancy. And with me, I'll allow my colleague to introduce himself.
My name is Dr. Rodgers, Shoshore Magigo. I'm also with Afrimom Pregnancy.
Okay, Ro. The first question that I have for you is, are pregnant women at higher risk of getting COVID-19? Looking at the other diseases that we've had that are respiratory related, they've had poorer outcomes in terms of pregnancy, or women that are pregnant. Is that the case with COVID-19?
Well, that's a very important and relevant question, given the background that we've just given. Indeed, it's a scare that pregnant women might be at a higher risk of COVID-19. However, with the little data that we have and little research around, it hasn't been established that pregnant women are actually at a higher risk of getting severe illness and actually contracting COVID-19.
Okay.
However, what we know is when women are pregnant, their immune systems, the soldiers of the body that fight disease, they become weaker. And also there are changes that happen in their body. For instance, when the uterus grows, it pushes the lungs up, and all these factors render them at a higher risk of respiratory infections. So it will be of paramount importance for them to actually take measures, precautionary measures, to prevent themselves from getting the virus.
Okay.
Yeah.
Are they a priority in terms of testing? Should they go in front of the queue in terms of who gets to be tested? Are they a priority?
Testing protocols and eligibility, they differ from country to country, depending with the resources and all that. So what the World Health Organization advises is that we prioritize symptomatic pregnant women. Yes, I think, and this is encouraged for all health bodies around the world.
Okay.
Yeah.
So let's say a woman is pregnant. Can she pass on the virus to her unborn baby?
That's also another very interesting question, and research is still ongoing to try and establish what really happens. But the few tests that have been done have not found the virus in amniotic fluid.
Oh, that's
you
good.
know, the fluid that surrounds the body and cushions them. And also in breast milk, COVID-19 has not been found in breast milk.
That's very
so
good. That's very good.
Transmission there has not been established, but research is still ongoing, and we follow up and see what we are going to see.
So is their care different? Pregnant women, do they deserve or do they need a different care when they are COVID-19 positive?
When a woman is COVID-19 suspected or positive, they should just be given the what I can call, they have a right. Let me say they have a right to high quality care like any other woman. What we call preclinical care, and also or antepartum care.
Okay.
Their clinic visits should be as regular as it should be. Intrapartum care as well, that is their delivery. They deserve a safe and positive childbirth experience where they've got a partner they trust during childbirth, where they receive good communication, which is clear from the staff that is helping them. They just deserve the right care from every other person involved. And even after they've delivered, they still need good support and care. But however, remember the mental health aspect. When a woman is pregnant and is COVID positive, she's more anxious, she has uncertainties. So it will be relevant that she actually gets an extra notch of support when it comes to mental health, counseling, and also good social support.
Okay.
Yeah.
And when the time of delivery comes, should they have a different type of delivery? Should they ask for a cesarean section maybe?
Well, a cesarean section is not indicated, or let me say COVID-19 is not a direct indication that we should then do a cesarean section on you.
Okay.
However, if there are any other medical, indications, or maybe if it's your personal preference, then we can start considering delivering you via cesarean section.
And she has delivered. How does she take care of this newborn baby? How is she allowed to touch the new bundle of joy and breastfeeding? Maybe if you could comment on that as well.
Yeah, sure. There are actually bodies I know the World Health Organization and the Center for Disease Control in America, they've got a bit of diverging views when it comes to that. But how I like the World Health Organization recommendation. They actually recommend more that early close contact, and early breastfeeding when a child is born is highly recommended. Yeah. Why? Because we know that early breastfeeding, it gives the baby that bolus of antibiotics, of antibodies that they actually need, that boost their immune system, and then will help them fight any other infection that comes along. And you know, there's also skin-to-skin contact that's important early on. That's also important for the baby. So they can breastfeed and they should have a contact with their baby.
Okay.
Yeah.
So the figures that we've gotten so far are showing that men are actually more at risk compared to women. But the other good figures that we have is that 80% of people who are COVID-19 positive will walk around without any symptoms. They won't need any hospitalization of any sort, or they won't need any medical attention of any sort.
Yes.
But however, there's a 5% who will have severe illness. How do you think the mothers or the babies who are born to COVID-19 mothers who are severely ill should be taken care of? How should they get help?
Well, in the unfortunate incident that a mother has born a child but is severely ill and they cannot properly move around or maneuver, then it's critical that they receive support in terms of breastfeeding their baby, as they are also being treated for COVID-19. As I mentioned previously, that breastfeeding is critical, and the benefits of breastfeeding actually outweigh, you know, the risks of transmitting the infection to the baby and everything else. So they should be supported. They should breastfeed and they should be supported. But maybe what's important here now is how do they breastfeed? Well, the first thing that they can do really is expressing the milk, and then the baby can be fed. And then later on they can then relactate if they improve or are well. The other thing that can be done is the use of donor human milk or other alternative sources of breastfeeding. But however, in our local settings in Zimbabwe, I would really advocate for expressing milk, since we have got there might be added costs that most of the population may not afford. However, let me just take you a little back a bit. We say the woman can breastfeed if she's positive and if she is able and she wishes to. Yes. But however, it's important that she also takes necessary precautions when breastfeeding, you know. Yeah. Practice safe respiratory hygiene. She should wash her hands before she touches the baby with soap or with an alcohol-based hand rub. And all the surfaces that she touches, she should make sure that she disinfects them. This is important. Although we know that we don't have so severe respiratory infections from COVID in little babies, but it's paramount that the baby doesn't actually contract the diseases in case the worst happens. So she should be cautious and prevent transmission to the baby.
Okay. Thank you guys for joining us. Thank you as well to Dr. Rodgers Magigo. Sure. As a parting shot, let's remember to wash our hands, socially distance, and to pray every time. May God bless you.